All right, we're just going to wait for people to pop in. Welcome to those that are starting to come in to our webinar. We are very excited to have our first webinar of 2023 and to have Dr. Owens of Body Basics Wellness Center here as our first expert presenter of the new year. So as people are coming in, I'm going to give it another couple minutes, but as people are coming in, I just want to go over some housekeeping rules. If you have a question, at the bottom of your screen, you should see a Q&A section. You can put it in there, or you can even put it in the chat if you like. I'm going to be moderating that for Dr. Owens as she goes through her presentation. So we do have a short amount of time. So I'm not sure why these people are going. Do you see them popping in? Anyway, we have a very short period of time. So as we are going through it, please hold your questions as long as you can, or just put them right in and I will get to them as soon as we can. Hello, Cynthia. Cynthia says good morning from Owens Mills High School.
Good morning.
So yeah, so happy. She's actually a new board of directors member of the Northwest Chamber. So happy to have you, Cynthia. Okay, so I will give it another 30 seconds. We still have people popping in and then we can get started. So I'd like to give a little bit of background while we're waiting for everybody. About Dr. Owens. Dr. Owens has a very extensive healthcare background. She is the founder of Body Basics Wellness Center and a seasoned healthcare professional with over 25 years experience, which I don't believe because she doesn't look like she's old enough to do that. She's also a wife, mother, and has a passion for health and wellness. And her focus is prevention, which is better than a cure. So prior to opening Body Basics Wellness Center, which is located right on Main Street, 42A Main Street in Reisterstown, you can pop in and say hi to them. So prior to opening Body Basics, she practiced primary care medicine and held privileges at local hospitals throughout Baltimore. Dr. Owens also owned and operated a large-scale urgent care in Prince George's County with X-ray, LabCorp, and pharmacy on site, and employed over 60 healthcare professionals. The urgent care was closed during the pandemic, which we all understand that, and then she changed her practice to focus more on preventive measures to improve individuals' health and wellness, which is more rewarding. Her mission and vision are to enhance the lives of those she touches and help people reach their goals. Many chronic illnesses are the core of obesity, and with diabetes being one of them that has the most complications and the highest mortality rates amongst some of other chronic illnesses. Through weight loss and other lifestyle changes, you can truly improve your health, lowering your mortality rates, and challenge those around you to become healthier too. I think I need that challenge every day, Dr. Owens. Yes. So yes. So without further ado, I'd like to have you start your presentation. And as people are coming in, I'll watch the Q&A.
Okay. Good morning, everyone. Good morning. Happy to be here and happy to have you guys here. So today we're going to be talking about how to prevent, control, and eliminate type 2 diabetes and metabolic syndrome. The Centers for Disease Control and Prevention indicated that diabetes is the epidemic of our time. Most people don't know, but type 2 diabetes, you are not born with it. It is inherited. Some facts regarding diabetes: complications of diabetes kill more people than breast cancer and AIDS combined. Another fact: diabetes is the #1 cause of blindness in adults in general. A third fact: diabetes doubles the risk of stroke and heart attack. Doubles. 1 in 13 people have diabetes. 1 in 4 don't know it yet, and 1 in 5 are at risk for getting diabetes. Unfortunately, type 2 diabetes is becoming an epidemic. 1 out of 3 children born today is expected to become a diabetic at one point in time in their life. That is disturbing. All forms of diabetes are caused by the fact that the sugar in the blood fails to make it into the cells. When the sugar builds up in the blood system, this is where you get high blood sugar or diabetes. If you're overweight, have high cholesterol, high blood pressure, without elevated blood sugar, you have metabolic syndrome. If it is not addressed, it would eventually lead to diabetes. Today, we will go over the causes and the problems, what causes these problems and the solution to them. Let's start by taking a look at why sugar fails to get into the system, get into the blood cells. When it's outside of the blood cells, that's when it becomes an overburden and you get the high blood sugar when you test your blood sugar. Insulin is a hormone produced by the pancreas, which has a role of opening the cells to allow blood sugar into the blood to pass through. If the sugar cannot get into the cells, this is where you get high blood sugar or diabetes. There's 2 reasons why the blood sugar doesn't go into the cell. The first is the lack of insulin, a hormone made by the pancreas, which acts like the key to unlock the cell door so that the sugar can get through. The second is a failure of the cell to accept the insulin and then open the cells to let the sugar in. Insulin will not work to open the cell wall. This is when it doesn't work, this is where you have insulin resistance. Despite a normal amount of insulin being made in your body, you will still get type 2 diabetes because the cell fails to respond to the insulin in your body. Since type 2 diabetes and metabolic syndrome are not genetic, you can do lifestyle changes to help eliminate or control or even prevent it. Lifestyle changes, we mean what are you eating, how you're exercising, and how you're taking care of your body. So remember, to eliminate diabetes, you simply must get the sugar that is normally in your blood into the cells by secreting more insulin or making the cells more receptive. And this is where you get, when it becomes uncontrolled, you get a high incidence of high blood sugar when you test your blood sugar. Why would your cells not respond to the insulin made by the pancreas? Great question. To find the answer, diabetes and most other health problems you might have, we must look at the typical diet, the role of your liver, your adrenal glands, and your nervous systems. All of this combine how your blood sugar reacts to how the food that you eat reacts to all of these organs, or how your organs react. So if you're here today and don't have diabetes, great news. However, we want to help you to eliminate any other health problems, as prevention is better than cure. So we're going to go over a stress and blood sugar survey. I'm sorry, I have this, sorry about that. So here, the next slide, I know you can't see that one, but here is some symptoms that if you have any one of these symptoms, I'm going to give you about 30 seconds to a minute to read the symptoms. And if you have any one of these symptoms or any combination, this is high risk for metabolic syndrome, which can lead to diabetes. So I'm going to give you about 30 seconds to tally up any one of these symptoms that you may be experiencing during the week.
Dr. Owen, should I be concerned when I'm like 15 out of 15?
Yes, you should. Well, it's not 15, it's 2 points for each.
Oh, okay.
So, yes.
So I win.
I'm going to give you guys another 30 seconds while I pause my share for a minute. Okay. So those numbers, you can keep it to yourself and you can share it with me later, but hopefully your numbers are low. But like Kathleen says, her numbers were high. That is not good. So do you have more than one symptoms? If so, let me tell you what that means. That means if you're experiencing more than one of these symptoms, you should be concerned about it. If it's never normal to have a symptom is the body's way of communicating that something is wrong and needs to be checked. So Kathleen, you need to see me. Would you check your car engine if the light came on? Of course you would. Symptoms are a warning that something is wrong. There's no such thing as a normal symptom. So if you're going to your primary care and they're telling you it's normal, it is not. Let me be the first to tell you it's not. Symptoms will only get worse if you don't address them. Today, you have two choices regarding your health. You can do the same thing that you've been doing and get the same results, or you can try something new, something different, and get different results. The choice is yours. If I can show you today how to get rid of your problems by doing something natural and affordable, would you do it? I'm sure many of you would say yes. Raise your hands. You can put in the chat box if you're interested in learning more. Now let's take a closer look. Oh, Rhonda. Hey, Rhonda, good for you. The reason your cells would resist insulin, it lies in the fact that you're the average American. Like the average American, you consume about 120 pounds of sugar each year. Up until 300 years ago, the only way to consume sugar was by chewing on a sugarcane stick. Total refined sugar consumption, this is showing how we consume sugar from back in the 500 ADs till the most recent was 2010 when this chart was combined, but it is much, much higher. And you don't realize how you're consuming sugar. It's in every carb that you can think, even in fruits and vegetables. As you can see, we now consume more sugar than our ancestors did once a year. To handle the large amount of sugar being consumed, the pancreas starts to release insulin in greater quantities. Over time, two things happen. First, the cell begins to expect a large amount of insulin to be released within the sugar we eat, and then when it doesn't, it will no longer work. The cells will only respond to more than normal amount. At the same time, the pancreas itself becomes exhausted from overwork and produce less insulin, which results in diabetes, and then you need exogenous insulin in the forms of shots. To help eliminate high blood sugar or any other health problems you're having, you need to take a look at what's causing these illnesses. The first thing that leads to this problem is too much sugar, in the form of donuts, cakes, cookies, pies, and some of the things that most of us like to eat. Secondly, we need to stabilize our blood sugar by eating 4 to 5 small meals a day, rather than 1 to 2 large meals with lots of snacks. According to researchers at Wake Forest University School of Medicine, in an issue that was published, 93% of diabetics just eat too much food or eat the food that's lacking nutrition and don't eat the recommended amount of fruits and vegetables that's needed. These nutrients can also help with the conditions. So we have several nutrients that we have here in my wellness center that we provide once you come in and get a consultation. There are several natural nutrients that are like plant-based that can help the body to process insulin and process blood sugar more easily. So I'm just going to flip through these. We can go into more details about them at a consultation, but I'm just going to put the names out here, briefly go through them. And these are plant-based, water-soluble things like cinnamon and turmeric and vandal sulfate. These are all blood sugar supplements. Our blood sugar support, this is a product that I have in my office. It helps, you can take it daily, and it helps with problems related to elevated blood sugars, metabolic syndrome, or even hypo or hyperglycemia. Finally, we need to address what our hormones are doing. The adrenal glands is the stress gland of the body. How many knows that when we're stressed out, our blood sugar also goes up? Not many, but yes, your blood sugar can be elevated when you're stressed out also. When you have too much stress, more than 50 hormones that are secreted by these glands can go out of balance. The adrenal hormone cortisol controls blood sugar by breaking down fat and keeping the sugar in your body at a proper level. If this hormone is out of balance, you will gain weight, you will be fatigued, you will have problems sleeping, maybe you'll sleep too much, maybe you'll sleep too little bit. In addition, you'll become more likely to develop blood sugar problems, as well as arthritis and asthma and allergies. The function of this gland can be measured by taking your blood pressure, laying down, standing, and testing it again. So I'm not asking any of you guys to be medical professionals here. I'm just giving you some information about how you can determine if your adrenal gland is working like it's supposed to. When you sit to stand, your blood pressure should raise 10 points. Your blood pressure should never stay the same. Every minute, your blood pressure changes. As a matter of fact, every second, your blood pressure changes. Stress can result in exhausting your adrenal gland, and it's a contributing factor for 80% of health problems that bring a patient to the doctor. So most of the times you're thinking it's one thing or another. 80% of your problems can be related to stress. Most people don't know that, but I'm here to tell you. These health problems include chronic fatigue, insomnia, digestive troubles, women's hormone problems, high blood pressure, heart disease, allergies, and inflammatory problems such as arthritis. Therefore, any program to improve your health and to address diabetes must begin with checking these stress glands, and if needed, repairing them through vitamins, diet, and exercise. My favorite. The fourth contributing factor to type 2 diabetes is a variety of health problems, being overweight. A unique and dramatically effective approach to weight loss is called nutritional detox cleansing, and most of what we do here in the office. This system of weight loss is dramatic because it works so quickly. As you can see, our program is likely to help you lose weight, lower your blood pressure, reduce your cholesterol levels, and improve your energy levels. Nutritional cleansing addressed the fact that each week we are potentially exposed to 82,000 chemicals throughout our air, water, food, and cosmetics. Yes, or cosmetic products can be potentially toxic also. Most people don't know that. The liver has a job to filter these chemicals out of your body via your urine and your feces. If you cannot eliminate all of these chemicals, they will enter your bloodstream in the form of free radicals. And most of you know, free radicals is a molecule which enters a cell, combines with other molecules, destroying their functions, often causing death of the cell. Our cells, we need our cells to be healthy. To stop this destruction, the body will form fat around to surround it, the free radicals, and then store them in your body. And then it eventually destroys your body. Free radicals also leads to cancer. It leads to many chronic illnesses. One of the results, you will start to gain weight because the free radicals are surrounding the fat and keeping them in place. We have a program here designed as a nutritional detox and weight loss. Of course, you need a consultation before we can determine what program is best for you. Most people obtain a dramatic results in the first 30 days of the program. Here are a few before and after pictures that we have of our healthy weight loss program. Nikki here, as you can see, lost 38 pounds. Mark lost 24 pounds. Kathy lost 45 pounds in just 60 days. And your very own me lost 18 pounds in just 4 weeks on the program. So one of the programs that we use here is called Vitamin Med. It includes an appetite suppressant, a kidney, liver, colon, and adrenal gland cleanse. We have Super Aloe and a B12 spray that helps with energy. Of course, the next factor of improving your health is mild exercise. You already know that you would be healthier if you were to exercise on a regular basis, but most people do sporadic activities. So rather than doing the sporadic activities, it will be very helpful if you could do it consistently. Our weight loss program here that we have, you can lose up to 30 pounds in 6 weeks to 60 days, which is 2 months. Our program does not involve exercise because you can truthfully lose weight by just what you eat. So instead of being in the gym, because most of the times, when you go to the gym, you work out, you burn about 400 calories, and then you go eat and you eat 1,000 calories. So you actually have a negative effect when you go to the gym. So most people go to the gym, they burn about 300 to 400 calories, and they eat a meal that's 1,000 calories because you're so hungry. Our program is designed to teach you how to eat, what to eat to become full and not need to consume so many calories. The next factor is the role of your nervous system, not only in diabetes, but regarding your general health. Undetected nerve damage from trauma not only affects weight gain and loss, it also affects your general health. By age 13, the average person commonly has 1,000 traumas from falls, accidents, and sports. Nerve damage often results not only in headaches, neck and back pain, but also numbness, sciatica. This sciatica is when you have the numbness in your lower back and it goes down to either one leg or both legs. Digestive disorders. It can also aggravate numerous unrelated health problems that you don't know that it might be connected, but it is. The number one reason people don't exercise is because of pain that may be associated with past traumas, and a lack of exercise, as you know, will lead to weight gain, as well as heart disease, heart attacks, strokes, and cancer. Diabetes can also develop severe pain and numbness in the legs in the form of diabetic neuropathy. So neuro is the word that means nerve, and pathy means a disorder or disease of the nervous system. Nerves are extremely sensitive because they're touch factors. So if these cells are starved for sugar, they will break down, and that's where you get pain in either your fingers, your feet, your toes, your joints, and cause you to have severe pain. In our clinic, we've been able to help people with diabetic neuropathy and other nerve-related pain by not only providing the essential nutrients the cell needs, but also improving your blood circulations to these nerves. As you know, nerves control every function of our bodies. Diabetes is a functional disease. It is a disease related to the lack of nutrition. So most people think that, oh, this is genetics. My mom had it and my dad had it, and maybe I should have it too. No, it's a functional disease. That means something that you're doing or not doing can be done to prevent it. So I know we are pressed for time, so I wanted to quickly flip through my slides. A combination of approach can be eliminating sugar from your diet, cleansing your liver and the body of toxins, restoring balance and proper function of your adrenal glands, removing the neurological damage, and mildly exercising. not only can this give you many factors to improving your health, it can also prevent diabetes from happening also, and many other problems that you might be experiencing. So we have a gift to you. My gift to you today is it's the opportunity to receive a free of charge, a comprehensive wellness consultation and screening. And you can drop your name and your information in the chat. You can also email me info@mybbwc.com, and Kathleen is going to put it in the chat. If you're interested in learning more, I know we only had 30 minutes for this, but I wanted to run through it really quick. Diabetes and metabolic syndrome, as I indicated, it can be prevented, it can be eliminated, and it can be managed. And most of it is at the core of weight loss. If you can manage your weight, lose the weight, and improve your diet, you can change a lot of health problems without having traditional medicines ongoing. So if anyone is interested, let me know, and we can talk. Any questions? I know that was fast. It was a lot of information, but if you have any questions or need any more answers and details, please feel free to drop it in the chat, and I'll be happy to answer those questions.
Dr. Owens, that was amazing. Thank you for all of that information in a way that we could understand it. So I know that I'm grateful, and I'm sure the attendees are as well. So there are a few questions. One is, okay, so you had mentioned being diabetic, of course, you can tell with the sugar levels. However, there was the metabolic syndrome that you talked about, that your sugar levels are okay, but you might have everything else. Correct? So tell us a little bit more about that. Like, we don't think we have diabetes. Well, we don't, because our sugar levels are okay, but we're prone to maybe getting it. So yes, what are some things that we can do like immediately to be able to manage and control that?
So one, you want to control blood pressure. You want to control the amount of carbs that you're taking in. You want to lose weight. Losing weight will control all of those factors. Losing weight will control, or if not, minimize, eliminate high cholesterol, high blood pressure, and also minimizing your stress levels. And it all starts with the weight loss. Because eventually, so your insulin is working, and eventually it's going to be a time that it's no longer working. And that's when you transition from that metabolic syndrome to full-blown diabetes. And that's when you're going to need exogenous insulin or pills to help you lower that blood sugar.
Okay. Is there any percentage of weight loss initially that can really get you going in the right direction? Like, yes, is it 10%, 20%? What is it?
That's correct. 10 to 20% of your body's weight. Yes.
Okay.
Most people may need to lose more, but at start, that will give you a good push. Yep.
Okay. And I know that, the BMI charts, either people love it when their score's low, but many of us hate them. So yes, how reliable or how much weight do you put into those kind of charts?
So the BMI, if you're over 30, you're considered obese. And I know most of us will get on the scale and height. So we have a full body composition analysis that would actually evaluate your fat percentage to your muscles. So some people might have more muscle than fat, which causes them to weigh more. That body composition analysis is able to determine that and will also correct in your BMI. However, if you have more fat than muscle, it would also determine that. So the BMI is a great indicator of your risk factors, because I know for many healthcare providers and doctors and stuff, they would not do surgery on individuals if their BMI is over a certain amount. So it is a great indicator of your risk factors and most of how we base treatment for that individual.
Perfect. And we have time for one more question. A participant says, I am type 2 and I am already small. What can I do to get off of the meds?
Diet, the types of food that are being eaten.
Okay.
It is the types of food that is causing you elevated blood sugars.
Okay, so I guess we all know those answers, the vegetables,
Yes.
all that
Yep.
stuff, right?
Increasing the fruits and vegetables, increasing, protein, eating protein, fruits and vegetables. Yep.
Okay, perfect. Thank you for that question. That last question we were able to squeeze in. It is 10:30, so time flies when we're having fun.
I know, I apologize. I had so many slides and so much information, but it's a lot to talk about in 30 minutes. But like I said, if you have any questions, you wanted to know about the natural supplements, you wanted to know about the plant-based that we offer. I practice a combination of traditional and alternative medicine. It is so easy to give you a traditional prescription and send you on your way, but it's much better to teach you how to prevent and eliminate those health problems as opposed to putting a Band-Aid on it. And that's my approach because, as you know, prevention is better than cure. You will be more effective and live a healthier, happier life if you can eliminate those problems as opposed to putting a Band-Aid on it and treating it. So that's my approach.
Well, thank you.
It is very functional.
Yes. Well, thank you, Dr. Owens. And Body Basics is right on Main Street in Reisterstown. The phone number and their address and their email has been posted in the chat. So I thank you again, Dr. Owens, for kicking off our webinar series for 2023.
So for having us.
Yes, and this is being recorded. So if you would like to talk or to take a look at it again or share it with anybody, look at the Northwest Chambers YouTube channel. It will be up there by the end of this week. So everyone have a wonderful day. Happy hump day. And thank you again, Dr. Owens.
Thank you. Have a great day, everyone. Thanks for attending.
Appreciate everybody's attendance. Have a great day.
Bye now.